The National Department of Health is calling for consumer vigilance when buying products from vendors and spaza-shops. This follows the deaths of 7 children around the country after allegedly consuming food items bought from street vendors as well as some spaza-shops. The department has since intensified inspections at different spaza-shops around the country. We speak to Campbell, a senior manager of food control at the Department of Health. Thank you very much, Ms. Campbell, for your time this afternoon. Perhaps we can start with an update in terms of these children that were either impacted and some of them then perished. What do the post-mortem results indicate in terms of what happened? Can we link directly what happened to those children who have since perished to the food items that they allegedly bought at some of these vendors and spaza shops?
Good afternoon to you, Dudu, and to the viewers. Unfortunately, that information is still with the South African Police Services, as they would be responsible for the forensic and post-mortem reports, because these were deaths that were unnatural. So we are still awaiting the outcome of those reports.
Okay. How long typically does that take, especially when we understand that at some of our forensic labs there are backlogs, or are certain cases being prioritized? Are you privy to the information?
Unfortunately not, because it's such a sensitive investigation. The South African Police would be the best to inform you on that.
Fair enough. Being part of the food control at the Department of Health, what is it that you yourselves have at least noticed?
Okay, what we have noted with concern is that there has been, following the operations that have been done by the municipalities and the police as joint lawful operations in terms of inspecting some of the illicit areas, they've uncovered some products that are being manufactured that might have not met hygiene standards, and it's for this reason that we are being overcautious to say to members of the public, be careful with what you are purchasing from spaza shops now.
Okay. Do you conduct inspections?
No, we as the National Department do not conduct the inspections. We develop the legislation that is then delegated to municipalities, the metro municipalities and the district municipalities to enforce. So, for example, in the city of Joburg, where the first 2 deaths were reported, the city of Joburg has been doing operations with the police as well as in the West Rand, and I think it's in both of those areas where they've uncovered this illicit operations, and that's why we are saying please be careful.
Does this apply to the rest of the country? So where inspections are concerned at least, so does the health department not have any inspections where food control is concerned?
No, food, we do not do any inspections. What happens is that there are a certain number of functions within the health system that have been deemed to be needing to be done as close to the community as possible, and this we call municipal health services, and it's basically all the activities that environmental health practitioners perform. So they do water quality monitoring, they do food control, they do chemical safety. It's a list of 9 functions that they are required to perform. But the Foodstuffs Act, from which the regulations that they are required to enforce, including hygiene regulations and labeling regulations, come from the Foodstuffs, Cosmetics and Disinfectants Act, which the National Minister oversees and administers, and then he is responsible to develop those regulations.
Okay.
The environmental health practitioners in those municipalities then enforce the legislation. So to determine whether a spaza shop is legitimate or not, it must have a certificate of acceptability under the hygiene regulations. Mm-hmm. And usually this is what a consumer can request or identify whether a food premises, whether it's a spaza shop or whether it's a restaurant or quick service KFC, they are entitled to ask for it if it's not displayed on the wall, so that they can be assured that it has been inspected by environmental health practitioners based in that municipality. Also, if they have complaints about food, they can also report those to those environmental health practitioners as well at the municipalities.
Ms. Campbell, are distribution centres also part of the inspections, right? So maybe the spaza-shops, that will be the end point, or a certain food outlet, that will be the end point. But the starting point, the distribution centres, where the food is manufactured, how it's manufactured, how it is stored, where it is stored, is that checked as well?
Yes, all premises that want to do anything with regards to food, whether it's just to keep it as in storing it, or whether it's to actually have a fully fledged manufacturing facility, must have a certificate of acceptability. And the informal sector is also regulated under those regulations. So the street food vendor, the spaza-shop, is also supposed to have a certificate of acceptability. What we've uncovered is that, not us, but the municipalities and the police, is that there are illegal operations. So they're operating in the backyard and in somebody's house, and then manufacturing food which is not acceptable.
Thank you very much for your time this afternoon. Senior Manager of Food Control at the Department of Health, Penny Campbell.